First, I want to begin with gratitude for the student-centered work that has happened throughout our district community, especially in recent weeks. As you'll hear tonight, with the hard work of our IMS team, new devices continue to arrive ahead of schedule as part of our one-to-one technology initiative. Schools are working evenings and weekends to distribute those devices to our young people as quickly as possible once they arrive from our supplier. We're seeing teachers elevate their efforts to engage students virtually. We've shared looks inside our classrooms across our district on social media platforms. As we learn and evolve, our remote learning instructional model tonight is about our future-focused work to plan and prepare. In early August, when we announced our transition to the remote learning instructional model, we communicated that the announcement was for our first quarter of the school year. We want to learn in person with our students. We also have a responsibility to our students, staff, and families, and our entire community. This evening, we will discuss where we are and how we move forward together. That includes considerations for an eventual in-person return, both in our Family 3-2 model and at 100% in person, when it is safe and responsible to do so. We're looking to data like case trends, positivity rates in our area, and guidance from our community partners and health experts. We know conditions can change and change rapidly. We all heard the concern from health professionals ahead of Labor Day weekend, knowing that large gatherings without safety precautions could affect trends in the Omaha area for weeks to come. There are many variables and no crystal ball or universal roadmap. This is why we want to provide this opportunity with our Board of Education to review where we are and plan for where we want to go. What do we know? It is that our care for students, staff, and families is constant. Our guiding principles focus our decision-making just as they have since this winter and spring. Before our team begins discussing our current work, I also want to introduce and extend our gratitude to Dr. Christine McVeigh, Chief Medical Officer for One World Community Health Centers. Dr. McVeigh is an MD who earned her undergraduate degree at Stanford before attending UNMC. Her residency focused on internal medicine and pediatrics at UNC Chapel Hill. Dr. McVeigh also earned a master's degree in public health at the University of North Carolina School of Public Health. We appreciate partners like One World and Dr. McVeigh, who will be able to answer questions from our board members soon. It is my pleasure to introduce Dr. Lisa Sturba, who will begin the presentation this evening. Dr. Sturba is our Chief Operations Officer for the Omaha Public Schools to begin our discussion this evening. What we would like to do is to present the entire presentation in its entirety and then answer any questions or have discussion from the Board of Education about the things that we have presented. Dr. Sturba?
Good evening, President Snow, Vice President Holman, Superintendent Logan, and esteemed board members. As we plan for return to learning, we have been collaborating with our community and educational partners. One partner of ours, Student Transportation of America, helps us transport 18,000 students to school every day. We have been in close contact with them as we prepare to return to in-person learning. STA has told us that they would be able to ramp up services and be ready to transport elementary and secondary students within a 2-week time frame once a determination is made to proceed with in-person learning. Our automation specialists, steam fitters, and machinists have been working on schedules of our HVAC systems to introduce fresh air into the buildings at the greatest level possible, with a goal of refreshing building air by outside air by 200%. HVAC temperature set points for occupied areas are set at 73 degrees, while unoccupied areas are set at 80 degrees, based on the standards established by the CDC. Dampers are open and the HVAC system is tampered down at 5 p.m. in most buildings, again, to bring in more outside air. They're phased back on by area 2 hours before staff returns. That's 5 a.m. at our secondary buildings and 6 a.m. at our elementary buildings. In every HVAC system, there are filters, and every filter has a minimum efficiency reporting value, or a MERV value. This rating measures how efficiently the filter captures particles of specific sizes that pass through as the system operates. MERV ratings range from a 1 to a 16, with a 16 being something that's used like in a hospital surgical setting. Most air filters in homes have a MERV rating of 1 to 4, and all of that does, it filters out pollen, dust mites, and fibers. The Omaha Public Schools has used MERV 8 filters in most buildings prior to the pandemic. We are using MERV 10 to 13 filters in our HVAC systems to better clean the air being introduced into classrooms, hallways, and other common areas in the building. In the district, we have 5 housekeeping specialists. Each housekeeper is assigned specific schools to ensure that there is a consistent standard of cleanliness. They visit those schools to make sure that they meet the standards of the Omaha Public Schools. They also look for daily tasks in every area within the building, as well as the grounds, to make sure that they are meeting standards. Checklists are also provided to operations staff to help remind them of daily tasks, with the reminder that cleaning is the removal of dirt and other unwanted particles like dust. Once a building is clean, then it is sanitized with an ionizer or an electrostatic sprayer. An ionized and electrostatic mist will wrap onto surfaces such as an armrest or the underside of a desk, or a windowsill or other hard-to-reach areas. In those ionizers, we're using Pure Tabs, QT3, or Total 360 as a way to sanitize. All of those products have a 2 to 5 minute kill time, so as soon as it hits that virus, it's dead, or any bacteria, it's dead in 2 to 5 minutes. We're using those same cleaning techniques and products in our buses. Now I'll turn it over to Mr. Charles Wakefield, Chief Human Resources Officer for the Omaha.
Thank you, Dr. Starba. Mr. Ray, do we need to wait on the PowerPoint? We're good? Okay. Good evening, Mr. Snow, Dr. Logan, board of members. In the PowerPoint slide you cannot see, we are discussing staffing levels. As you would expect, hiring during a pandemic has been difficult, but our great team has worked with our schools and worked hard to appropriately staff positions across the district. While our staffing levels are slightly lower than a normal year, they are not low enough to create a significant issue across our district. When we look at specific staffing positions that directly impact our ability to return in person, we note that our bus drivers are currently staffed at 89%. To give you some context, in previous years we averaged between 90 and 95% staffed each month. Our cafeteria staff, our nutrition services individuals who help feed our students, are staffed at 89% as well. And again, putting this in context, in previous pre-pandemic years, this set between 85 and 90% staffed each month. Finally, our custodial staff is staffed at just under 96% right now, and this mirrors levels pre-pandemic, so we're right in line with where we typically are. Overall, our certified staff, or our teaching staffing force, is 98%. This is slightly below our pre-pandemic levels and our pre-pandemic average of a 99% staffing level to start the school year. When we look at the certified staff by school, we currently have 5 schools that are below 95% staffed. However, when we look at individually at each of these schools, they are each over 94% staffed. In each of these cases, we have worked closely with the building principal and school staff to provide either long-term substitutes or identified other resources within the school that can provide the support needed for our students while we continue to try to staff these positions. We also have one program that is below 95% staffed, but this is a program that has a small staffing level, and its one vacancy puts it at 93% staffed. Special education also continues to be a concern. Special education is experiencing a multi-year nationwide teacher shortage that makes this the most difficult certified area to staff each year. Even with this ongoing shortage of special education teachers across the nation, we are over 93% staffed with special education teachers. We continue to make this a priority in recruiting and work with curriculum and instruction services to ensure all schools have the resources they need to support students. Finally, as we look to return students in person, we also need to consider the impact of COVID-19 exposures at each school site. We currently have 76 buildings or departments that have had at least one staff member placed on short-term public health leave. This public health leave can cause a staff member to miss 10 or more days. We continue to monitor the impact that this has on individual schools and work with them to support with substitute teachers or other coverage options within the school. I believe Ms. Colmine, our Chief Academic Officer, is next to address program offerings. Ms. Colmine.
Thank you, Mr. Wakefield. Good evening, President Snow, Vice President Holman, Superintendent Logan, and members of the board. With me today is Susan Christofferson, to my left. She is the Director of Secondary Education, and she will be able to engage in discussion and answer questions at the conclusion of this entire presentation, as mentioned by Dr. Logan. In the Omaha Public Schools, we offer a variety of secondary programs that serve our students. As we continue to prepare for a responsible and safe return to school and to maximize student learning, we have reviewed enrollment numbers in each of our secondary programs, the number of students in each section or class, and the amount of space available in our classrooms. After this review, we believe that when we are able to return safely from a 100% remote model, we have some programs that can return 5 days per week while safely social distancing with some modifications, and some programs that should return in a 3-2 model to safely social distance. On the PowerPoint slide that you cannot see, you will see these programs, so I will state them for you. We do believe that the following programs could come back 5 days a week. They are Parish, the Zoo Academy, Gateway to College, the OPS UNO Middle College, and Student Success Program. We also believe the following programs should come back in a family 3-2 model: the ESL Teen Literacy Center, Career Center, Accelerate, Independent Study, and Blackburn. We also have a great partnership with UNMC, and we will continue to partner with them and take recommendations in collaboration with them to determine when it's appropriate to have our students return in a responsible and safe manner to the UNMC site. The Omaha Virtual School Program is currently 100% remote, and we would recommend bringing them back in a modified blended instructional model. At this time, we are aligned with the Omaha Public Schools decision to be in a 100% remote setting, and that's where all of our programs currently are. Please note that at this time, our special education programs are not included in this particular PowerPoint slide, as they will be addressed later during this workshop and other slides. Thank you, and at this time, it is my pleasure to introduce Mr. Steve Eubanks, our Supervisor of Athletics.
Good evening, Dr. Logan. Mr. Eubanks, can you push your mic on?
Push the button, Steve.
Green button.
Good evening.
Good evening.
Much better. Good evening, Dr. Logan and Board of Education members. Just as we are preparing for an in-person return to learning when it is possible, we very much look forward to the return of athletics, arts, and activities when we can provide them in a responsible way. Currently, we've been working with high school athletic directors to create a proposal to submit to the NSAA for our fall student athletes to participate this spring. The proposal would request dual participations for athletes to participate in fall and spring sports simultaneously. We've also been preparing guidelines and protocols for safe and responsible return for winter sports and activities as conditions permit. Winter sports are scheduled to begin on November 16, 2020, and they would include boys and girls basketball, boys and girls swimming and diving, wrestling, and boys and girls bowling. Also, unified bowling would begin their season on Monday, October 19th, 2020. The use of our outdoor facility spaces by organized teams and groups via the permit process will be considered once we are no longer remote. Currently, individual constituents can utilize our outdoor facilities at any time. At this time, I would like to introduce our Chief Academic Officer once again, Mrs. Melissa Comine, who will provide the details of the remote learning model.
Good evening again. Thank you very much for this opportunity. As we prepare to return to in-person learning, we are refining our approach to remote learning in support of families who may continue to want to continue to be in a 100% remote option through the end of the first semester. The remote learning model is designed to be 5 days of instruction, which may be a combination of synchronous and asynchronous lessons with continued adherence to district common grading practices and attendance policies. We are planning for a model that allows teachers to facilitate instruction for their students in person and remotely simultaneously. Students may also receive asynchronous lessons from their teacher or a district staff member. In addition, it will allow students to remain in currently scheduled courses for continuous learning and a seamless transition. It is important to note that as we prepare for an eventual return to in-person learning, time allotments would be adjusted to meet changes in the district instructional model. In some scenarios, the remote learning model time allotments will be adjusted to align with daily learning schedules in school. As we continue preparing for the remote learning model, providing a quality teaching and learning experience for all learners will remain our focus. It is now my pleasure to introduce Mr. Brian Dunn, the Director of Information Management Services.
Good afternoon, President Stowe, Vice President Holman, members of the board, Superintendent Logan, and community members in attendance. Today I'm here to give you an update on our one-to-one technology initiative. You have to excuse me, I haven't figured out glasses and a mask at the same time. We have approximately 45,000 new iPad devices that have arrived and are in use for remote learning. I'm happy to announce that our middle schools and some of our high schools did receive the iPads ahead of schedule, as much as 2 weeks ahead of schedule. We have 4 high schools that are awaiting the arrival of the iPads. We did learn this morning that shipments went out today, so hopefully those will be in schools by the end of the week. As far as our connectivity and some of our software platforms, OPS holds a weekly status call with T-Mobile and communicates each day about matters that need attention. T-Mobile will also have a team on the ground in Omaha this week. They'll arrive tomorrow to help us further troubleshoot any remaining issues and solve some of those problems. Our building tech support and tech trainers provided support to students and families since the beginning of the deployment. In addition to serving at the family support centers during the first week of school, they continue to offer support to schools. We've used attendance data indicating a tech absence to help our trainers and our team support schools as they provide further support during the remote learning. We also collaborate regularly with some of our other vendor partners like Microsoft on any platform issues that may come up in order to provide solutions for any of our staff and families. Now it's my pleasure to introduce Kara Saldanera, Director of Special Education, to talk about the special education program.
Good evening. I'm going to share a few special education updates. Special education staff have been scheduling in-person services for Braille instruction, nursing, and orientation and mobility. In-person equipment checks have been scheduled for students receiving physical therapy, occupational therapy, audiology, and assistive technology. School psychologists and speech-language pathologists are conducting in-person evaluations. And we have also expanded our in-person services to include kindergarten through second grade ACP. This is one-on-one direct instructional services during their individualized learning time. We continue planning to expand in-person special education services with a focus on health and safety. We have done specific work related to health and safety measures for students, including collaborating with UNMC global health experts on best practices, especially related to serving medically fragile students. We have planned for additional PPE to be provided for staff who have close contact with medically fragile students. We have planned for continued training for staff who work closely with medically fragile students, including PPE usage, personal care activities for students, and cleaning and disinfecting. Our regular conversations with medical partners continue. I will now turn it over to Jeremy Maskell, Executive Director of District Communications.
Thank you very much. Good evening, President Snow, Superintendent Dr. Logan, and members of the board. Always, but especially during this time, we value open communication with our staff, our families, and our community. Throughout the last quarter of the 2019-2020 school year, and again this fall, we have communicated with all staff and families on a weekly basis through our health and safety newsletter, which is designed to relay important information in ways that are easy to review and remember for those we serve. Based on survey data both before and during this pandemic, email was the most preferred delivery of communication among respondents. From the release of our plan for a responsible return to school in June, we've used our website, ops.org, district social media channels, all to keep families up to date, adding important information as it develops, giving a look inside our classrooms, and providing families with strategies for success as our partners in that effort. We appreciate the many languages that are spoken in our district community. And thanks to collaboration with our bilingual liaisons and student community services, our weekly messages are delivered not only directly in English and Spanish, but translated and posted in Karen, Arabic, Nepali, and Somali. We know our stakeholders have many questions about what's ahead. We always look to provide information that is relevant and useful. We strive to be responsive. That is why we provide these updates each Wednesday evening with the information that we can at that time, including the important note that conditions and our work may need to change in response to those evolving conditions. I believe at this time, Dr. Logan, I will give it back to you.
Thank you. As we consider the metrics for a 100% return, we want to start there. And these metrics were sent to the board on August the 11th, right after we announced that we would be in a 100% virtual format. These community conditions were formulated in consultation with medical partners. Drs. Lowe and Drs. Lawler worked with myself and other staff members actually on a Sunday evening to ensure that we had these on that following Monday. They are the following: testing availability, the ability to test staff and students quickly, same day if needed, with a less than 48-hour turnaround for results. The reason that that is really important is because if we have exposures, which of course we would because of the nature of this virus, we would not want to have staff members out for very long periods of time, nor students. The community spread controlled at 50 cases per million. I did speak with Dr. Poore this afternoon about 5:30, and she had received an inquiry from a constituent about this number. This number is higher than it is in other countries, but it's the number that Drs. Lawler and Drs. Lowe suggested that we use here in the Omaha Public Schools for community spread. And it is 50 cases per million, and not necessarily 50 cases in children, 50 cases in adults, just 50 cases period per million, just in case that comes up. The positivity rate below 5%, ideally below 3%, and staff impact. Mr. Wakefield spoke a little while ago about sometimes our ability to operate a school program could be affected by numbers of people who may need to quarantine. Indeed, we had a school last week that we did have to close because of the number of cases of COVID among staff and the likelihood that it was spread in that facility. The next thing that we want to talk about is to look at our positivity rates by the zip codes that we serve. On the slide there, it's a little difficult to see. I know the board members have a printed copy. You're able to see the zip codes, and the numbers appear, the darker red, the numbers are, the higher the positivity rate. The highest positivity rate was 23.3% in 68102 and 20.8% in 68131. For reference point, the zip code where I live at 68154 is at 10.6%. As you can see all along the continuum, and the numbers there also have the number of students that are in each of the zip codes. So you can see impact by large numbers of students, for example, the numbers of students in 68107 and the positivity rate at 16%. The current positivity rate for this week went down a bit, which is good news, to 9.6% for all of Douglas County. And so it, for us, is really important for us to not just look at the overall, but also for the students and community members that we serve. And the chart there gives you an opportunity to see that. Now, knowing that we're trying to get to 5% as the recommended rate, we have to have a conversation this evening. And that conversation is really going to be about risk, because we know that we are not going to likely get to that 5% anytime soon. And we have to make some decisions or to have some discussion about that number, because going back where the with the rates as high as they are, we can reasonably predict what could happen. And so we have to take, and I will tell you as a superintendent, have to take all of that into consideration when we're making these decisions about the amount of risk. These are, it's not just our young people, although our young people are obviously the most important thing. It's the people that they go home to. It is the multi-generational households that many of our families live in, and all kinds of factors. And on the other hand, we can't stay home forever. And we know that children benefit from being in school. And the children who need to be in school the most oftentimes have many of the risk factors that we are also very worried about. And so this will not be a plug and play. It will not be putting a number in an equation and coming out with the just one answer. It is a combination of things for families, which is why we have many different options as we move forward. And so as we start to have the discussion, and I have a few more slides that I'm going to get to talk about a return to in-person learning, what it could potentially mean. But I want to put all of that out on the table, because it's really important. And it's very important that we everybody has the information that we have, so that they can see what we are considering. So I'm going to move on to non-negotiables, and then we're going to have, is Dr. McVeigh here now? She's here. There you are. And she promised she was going to have scrubs on, so that's even more cool. Yeah. I'm going to go through these, and then we're going to have you available for questions and opportunity to speak. So as we start thinking about a return, and I talked about the risk factors and determining what that risk should be. Some of the things that we think are important are 5 days of instruction for our students, either via Teams or in person, so either the 3-2 model or in person for some of our learners who likely need to be in school the most, our littlest children, and obviously our students receiving specialized services. 5 days of instruction for students who receive ACP supports or attend JP Lord School. layered health and safety precautions, including facial covering and social distancing, which would mean we would need to remain in a 3-2 for most of our students. Remote learning options that maintain the student and teacher connection. At the beginning of the school year, when we had the remote learning option, students didn't know their teacher. And so now students know their teacher, and they probably love their teacher in many cases. And so making sure that they can still have the same teacher that they have is very important, I know, to students and especially families. And so in a draft, this is a draft of a phased return to 3-2. You will notice we did not put dates on this because we want to have this conversation with our board members, able to ask questions and to move forward. In the 5 days per week in person, the phase 1 would be for students at JP Lord School. In phase 2, and there in some of these, there's not necessarily, some phases could potentially go together or not. 5 days per week in person for a K-12 ACP program, transition, elementary behavioral skills program, also known as BSP, early childhood special education, and our hearing impaired classrooms where students have a separate class. In phase 3, in a family 3-2 model, our elementary schools, elementary resource and all related services, 5 days per week in person for zoo, Gateway to College, the programs that Mrs. Comine spoke about a little earlier, and in person for home-based and homebound services where a person goes into the home. Continuing on to the last and final page. In phase 4, a family 3-2 model in middle school resource, behavioral skills program in middle school and all related services, and 5 days per week in person for parish and the student success program. And in phase 5, a family 3-2 model for high school resource, BSP, and all related services. ESL Teen Literacy Center, Career Center, Accelerate, Independent Study, Blackburn, and 5 days per week in person for the Omaha Virtual School, which actually is virtual, but modified blended instructional model. Those students come in 1 day a week along with their learning coach, typically one of their parents. And so that would be how we would return. As Dr. Sturba said, we have spoken with our partner, our Student Transportation of America partner. They've given us their ramp-up time. We have to look at some of the community conditions and then start making some decisions about when it is appropriate to return to school. And I'm going to, at this time, one of the other items that I did want to mention, and I was able to send this to our board chair and vice chair this afternoon because I got it this afternoon, was that we have talked about being able to, the necessity for, and I just sent it really late, like 6 o'clock, so I didn't get to send it to everybody else, but we were able to talk with one of our partners who is working on some rapid testing for us that we are not going to formally announce this evening, but they indicated that they are really positioned well to be able to deliver that to us within 8 weeks.